Hi guys, I'm gonna read a little story that I wrote about the 12 cranial nerves. So to begin, once upon a time, 12 cranial friends worked together to help Diana survive in the land called the brain. Some cranial nerves work in the sense and motor department, while others work in both. To begin, there is olfactory, which oversees Diana's sense of detecting and processing smell. The receptors in Diana's nasal cavity pick up the odors and send signals to the brain. Without olfactory, Diana will lose her sense of smell and inability to distinguish odors. Diana has big brown eyes. Optic is responsible for looking out for danger towards Diana and dilating the pupils. Optic is in the brain's occipital lobe and also receives help from the optic nerves, optic chiasm, and visual cortex. Without optic, Diana would bump into walls, get lost, and no longer participate in her favorite activity, shopping. Ocular, motor, trochlear, and abducens are the eye movers. They work together along optic. Ocular motor is responsible for moving optic in any direction, so like up, down, side to side, like that. It moves Diana's eyes in any direction with the superior, inferior, and medial rectus muscles and the inferior oblique muscles. Without ocular motor, Diana will have a difficult time focusing on incoming danger. Although ocular motor helps optic move Diana's eyes in any direction, cochlear innervates with the superior oblique muscles, allowing optic and ocular motor to move Diana's eyes downward and inward. A crossover in fibers in the brain stem allows the trochlear nerve to send signals on one side of the brain to control the eye movements on the opposite side of the body, resulting in perfect coordination between both eyes. So this side controls this side controls this eye. So with them helping each other, your eyes move like that. Without trochlear, Diana cannot look for danger from the left side and look beneath. So I wouldn't be able to go like that, and like that. Okay. Trigeminal, facial, and vestibulocochlear provide Diana's facial and ear functions. Trigeminal is a busy and long lady. She works in three prominent branches: the ophthalmic branch, maxillary branch, and mandibular branch. All departments work together to send signals to the brain in case there's a hair or on Diana's face, so sensation. Make sure her face hurts just in case she hits her head, so pain. Make sure she feels the temperature change, so like your face gets cold or you start getting really hot in your face. And controls Diana's chewing muscles. So when trigeminal works in the ophthalmic branch, she provides sensation to Diana's forehead, scalp, and eyes. So yeah, so I just did it right there. So it works because there's a hair in my face, so I was able to move it out the way. When trigeminal works in the maxillary branch, she supplies sensation to the middle portion of Diana's face. Without this face, Diana cannot sense her boyfriend's warm face when they hug, so I wouldn't be able to feel that, like this part right here. Lastly, when trigeminal works in the mandibular branch, she controls the chewing muscles and provides sensation to the lower part of the face, and the jaw. Once again, it is essential when Diana and her boyfriend go out to eat. She needs to be able to eat all her food without choking. Yet sometimes she seems to aspirate on water or air, but that is glossopharyngeal and vagus's fault. Oh my god, I forgot about abducens. He is also an eye mover. I don't know how I forgot about him. He is responsible for controlling the movement of the lateral rectus muscle in the eye. In other words, He controls the lateral rectus muscle responsible for the eye's abduction and outward motion. Silly me, he is so vital. Without him, Diana would have a condition called abducens eye palsy, causing Diana to have impaired lateral eye movement. So I wouldn't be able to go like that, resulting in double vision and eye misalignment. So my eyes would go like that. They would just be like that or like that. Treatment would include medication, vision therapy, and surgery, which Diana cannot afford at this point. All right, so back to Diana's face and ear functions. Facial is responsible for controlling the muscles of the for facial expression and blinking and tearing reflexes. It causes Diana to express her feelings through her facial expression. So as you can tell, very expressive with my face. Facial begins her journey from the brainstem and travels through the facial canal. From there, facial branches out to various facial muscles. So it goes from your brainstem and then expands towards all your face. Facial carries taste sensations from the front 2/3 of the tongue and provides afferent sensory fibers from various glands such as the lacrimal and salivary glands. So facial is also responsible for 2/3 of the anterior part of the tongue. Suppose facial one day becomes unable to perform her duties. In that case, Diana will face paralysis on one or both sides of her face and have difficulties with taste sensation and excessive tearing. One of Diana's little friends with the longest name is vestibular cochlear, also known as auditory. He is responsible for transmitting sound and balanced information from the inner ear to the brain. The sensory fibers in Diana's ears help her be aware of movements and body position and identify all the different sounds that come across. Vestibular begins his journey from the inner ear and travels through the temporal bone. Later, it reaches the brainstem. Without vestibular cochlear, Diana cannot listen and process the latest tea and would always be dizzy. Vestibular cochlear would need cute hearing aids or cochlear implants to help him function correctly. Glossopharyngeal and vagus help with the swallowing and speaking. Sometimes they are distracted, causing Diana to aspirate occasionally, but both of them work in the sense and motor department. Glossopharyngeal arises from the medulla oblongata and travels through the skull, innervating through the tongue, the throat, and the salivary glands. Glossopharyngeal is responsible for taste sensation from the posterior 1/3 of the tongue, so mostly the back part of the tongue. There are millions of taste buds that allow pharyngeal to carry all the different tastes to the brain, including mastication and deglutition. So since the tongue has many taste buds, glossopharyngeal is able to send those tastes to the brain, and the brain identifies those tastes. If glossopharyngeal is not working correctly, Diana can have trouble swallowing, speaking, and lose sensation in her throat and in her tongue. Vagus is the longest of all the cranial nerves and has many functions. She extends from the medulla oblongata all the way to her abdomen. She's responsible for transmitting sensory and motor information between the vein and various organs in the body, including the heart, the lungs, and the digestive tract. Vagus regulates Diana's heartbeat, breathing, digestion, and other critical functions. Vagus also has different roles called sympathetic, parasympathetic, and enteric nervous system. Sympathetic system is in charge of Diana's fight, and flight response. So in case something happens like that, Diana, that works. Parasympathetic system helps Diana return to homeostasis after flight, fight, or the flight response. So that's just called homeostasis. And it also helps her regulate her heartbeat, blood pressure, and decrease alertness. The enteric nervous system is a complex network of nerves that control the function of the GI tract. The ENS regulates digestion, absorption, and elimination of coordination of movements in the GI tract muscles and controlling blood flow. It also communicates and works with the central nervous system, sending signals from the gut to the brain. So vagus is always working. Accessory and hypoglossal control the shoulders and tongue movements. Accessory, like vagus, arises from the medulla oblongata. She is responsible for the intervention of the trapezius and sternocleidomastoid mastoid muscles, which are essential for the stabilization of Diana's head and shoulders. Accessory is a necessary for Diana to turn her head, lift her shoulders, and maintain good posture. Hypoglossal, Diana's last friend. Hypoglossal works hard daily from the medulla oblongata through the skull and neck, innervating with Diana's tongue muscles. Hypoglossal loves participating in daily activities such as talking, swallowing, and masticating. However, hypoglossal just prefers to talk all day. Like her other cranial nerve friends, hypoglossal, she receives signals from the brain to help her make precise movements for talking, swallowing, and chewing. And she doesn't seem to ever get tired. Suppose hypoglossal cannot participate in speaking, deglutition, or mastication, Diana will become unintelligible, develop dysphagia, and become malnourished because she can't chew or swallow her food. Together, they ensure Diana functions smoothly daily, always keeping her happy and healthy. Sometimes.